Parents often miss OCD compulsions. They call them quirks, tics, and habits. So how can you tell the difference? I'm about to tell you. Stay tuned. That's what's up next. For starters, if your child has a history of anxiety or if OCD runs in your family, you want to pay closer attention to your child's behavior because the earlier you can catch OCD compulsions, the better the long-term prognosis. So you want to look at your child's behaviors and habits and look and see if they make any sense. Is there a reason why your child should be doing that? And if it's a habit, and a lot of kids do have quirky habits and routines, that's okay. But if it's a quirky habit or routine, they really won't be too upset if you mess with it. And so what I recommend parents do, and what I do with my own kids, to see if it's an OCD issue or to see if it's just truly a habit, is I mess with it. So if they're doing something in a certain way, I might have them do it in a different way. Hey, you know what? I noticed that you always have to straighten out your blankets before you go to sleep. How about we do that after we brush our teeth? Is my child flexible? Can they handle that? Can they say, that's fine, I can do it afterwards? Or how about we do the opposite? You know, I notice that you always line up your food before you eat it. Let's mess up your food and then we'll eat it. And if your child's like, okay, whatever, then you're looking at more of a habit or a routine, which maybe gives them comfort versus a compulsion that is not a healthy thing. Pay attention to your child's body movements. I talk about this in a previous video on how to tell the difference between tics and compulsions, and I'll link to that in the comments below. But you want to pay attention. Does your child do any repetitive movements that look odd? Are they blinking a couple of times? Do they look up and then they look down? Do they make a hand gesture? Because a lot of those can be compulsions. And so you might want to ask your child, what does that mean when you do that? And see what they say. If they say, oh, I didn't even notice I was doing that, and then they stop doing it, then it might have been just a habit. But if you see that they continue to do it and they say, I just can't stop, I just feel like I need to do it. Or even more so, that they hide it and they try to do it when you're not watching, then you're looking at a possible compulsion. If your child needs you to do something, because a lot of times with childhood OCD, kids will involve their parents in their compulsions, and the parents will inadvertently finish that OCD loop and that OCD compulsion because they don't realize that they're a part of it. So pay attention to your role in your child's habits or quirky behavior. If your child needs you to say something back to them in a very specific way, then you can say it in a different way and say, you know, you control how you talk and I control how I talk. And so I'm going to tell you I love you in this way and not in the way that you want me to say it. And if your child has a full-on meltdown because of it, then you're looking at some compulsive behavior. If they're kind of like, whatever, I like the way that I want you to say it, but if you say it a different way, it's not that big of a deal. Then it's more of a comfort thing and not a compulsion. It's important to realize that some kids are embarrassed by OCD compulsions. In fact, most are, especially before it's diagnosed and even sometimes after. And so kids will hide compulsions and they will lie about compulsions because they feel weird and they feel embarrassed. And so if your child says, no, mom, it's not an OCD compulsion, it's a habit, or it's fun, or it's a game, or it's just something I like to do, you don't want to take that for face value. You want to continue to look at that behavior long term and see what I'm talking about. And if you're not sure, go seek a therapist and get some professional guidance if you aren't already. Differentiating a habit or a quirky behavior from compulsive behavior can be super tricky. I even have a hard time a lot of times with my own kids. So get some professional help and take a second look because you want to catch those things really quickly. It is important because even if a child goes through many different quirky behaviors, which a lot of kids do, compulsions change over time. And so a lot of times parents will say to me, Natasha, it's always something. She does this quirk, for 2 weeks and then it'll be something else. Yeah, that's not good. That's still OCD, and you still want to tackle the OCD because just because the compulsions change over time doesn't mean that it's not a big issue. It is a big issue. It's just that the compulsions are constantly changing. Now, people do have habits that change as well, but you don't want to write it off so quickly if OCD is in your family history or if your child already has a history of anxiety. I hope that helps. Sometimes it can be so confusing. Well, if you have any questions or comments, feel free to leave them in the comments below. If you're liking these videos, go ahead and subscribe because I have new videos that come out every Thursday. You don't want to miss them. If you want to get more of me, you can listen to my podcast, which comes out every Tuesday. And those are much more in detail. They're almost about 30 to 45 minutes long each episode, and they go over different topics than this. And you can find that at iTunes. It's AT Parenting Survival. Or I will leave a link in the comments below, and you can just click that. If you want to visit my website at anxioustoddlers.com, I'm always there, and then you can find my videos and my podcast in one place. And you can join my private Facebook group at AT Parenting Kids with Anxiety and OCD. I hope you're having a wonderful day. I hope you find the sparkle in everything you do. Don't forget to like my video, and I'll talk to you next week. Take care.
One, two, three.
Having a child with OCD is not only difficult and devastating for the child, but it takes its toll on the entire family. Watching your child do behaviors that don't make sense to anybody, and not even to your child, can be completely heartbreaking. And most parents don't know what to do or what their role is in how to help. OCD is a really complicated issue, and even a lot of therapists don't understand how to treat OCD. And so as a parent, you might be lost as to where to find support or what you're supposed to do in order to help your child crush their OCD. To make matters worse, many kids hide their OCD from their parents, so their parents don't even realize the extent of the issue.
I know my behavior doesn't make any sense. It's embarrassing. I don't want my parents to know. My parents don't even know half of the rituals I have to do.
Being in the dark is the worst thing for your child's OCD. No parent has to sit idly by, clueless about how OCD works and how they can actually help their child, because OCD is very treatable, and most of the approaches can be done very easily in your own home. I created the online class, Parenting a Child with OCD, to help you understand your child and understand OCD, but more importantly, to give you the tools to actually help your child beat OCD at home. You can take the online class at your own pace. Every lesson is there for you the minute you enroll, and you can go through it as fast or as slowly as you want to. You can also view the lessons on any device, so you can watch it on a tablet, on the computer, or even on the go on your phone. And every lesson is short and simplistic, so that you don't miss any concept or idea. Not only do you learn exactly how to implement cognitive behavioral therapy and exposure response prevention techniques at home, but you are given 23 handouts and worksheets that you can do with your child to implement the things that I teach you in this class. The class comes with 39 lessons that cover every aspect of OCD, from the origins of OCD to what themes to look for within your child, how to talk to your child about their OCD, how to talk to their siblings about OCD, and most importantly, exactly how to carry out exercises and challenges that will crush your child's OCD at home. OCD only gets worse as time goes by. Don't waste any more time. You can do things to help your child right away. Take the class, learn the lessons, and implement strategies and challenges at home and start seeing some improvement right away. You know your child the best. You see them struggling. You don't have to feel hopeless anymore. There are skills you can teach them. Let me show you how. You can enroll today at anxioustoddlers.teachable.com.